What would I want at end of life on hospice? You might think this is kind of a morbid thing to discuss, but it's something that we all need to think about. I've been a nurse for 30 years and I have seen hundreds of people die. And I've been involved in caregiving for a lot of people. And it's always best to think about it in advance. And what I'm talking about today, more than what I would want, but is things to think about as you are journeying through life and preparing possibly for your end of life. Or you may be the caregiver of somebody who is at their end of life. And it's important to understand that we all have choices and options. And what option we choose will sometimes determine how much suffering and how much anguish there is in those last few days, months, or even years. Because when you go on hospice, it just means that a doctor has said that you probably only have 6 months left to live. But you may end up on hospice for a couple of years. I have had patients that were on it for 2 years and even a patient that was on hospice for 3 years. So it's not a death sentence tomorrow. It is just that things are progressing in that direction. And sometimes people even come off of hospice because they're doing too well. So what 5 things are important? And I encourage you to respond to me and tell me in the comments what you think and what you would want. You know, what of these would you want and what things would you not consider to be important at end of life? And if you need help understanding how to be a caregiver for somebody who's at their end of life, put tips down in the comments and I'll send you my free guide on easy caregiving. So let's jump in there with number 1. My first thing that I would want is to be a do not resuscitate out of the hospital, or some places now call it allow natural death. And really, allow natural death is more how I think of it. So this means if my heart were to stop, just let it be stopped. Don't try and restart it with CPR. You know, we all hear about CPR on the TV and it sounds like it's a great, miraculous, wonderful thing that will keep us going. But in reality, what it means is that your ribs are broken. And now, if you are already towards the end of your life and now all of your ribs are broken, you're going to have a really hard time recovering from that, even if you did happen to come back to life. But you know that the recovery rate is less than 10%. So if you want to have all your ribs broken, then I guess you wouldn't want to be a DNR. But for me, I want to be a DNR. When I am no longer expected to continue living and having a good chance to survive CPR, then I don't want to have that as my last memories. Nor do I want my family to have that as their last memories of me. And then the other part of being a DNR is not necessarily part of being a DNR, but it is part of my thought process, is that I don't want any trips to the hospital. If I am expected to be at the end of life, let me be. Don't be trying to save me at the hospital. Hospitals are loud and they wake you up and they are not conducive to a gentle, restful time. That also means I also don't want to be rushed off to see doctors, all different specialists. Here, the people that live with me, I set them up on a house call doctor, and that's what I would want. Have the doctor come to me so that I can save my energy for doing the things that I love and enjoy and are still able to do. So number 2 is I want what I did for my grandfather. When he was on hospice, I brought him home and I put the hospital bed right in front of the big living room windows. So he had a beautiful view out the window to the garden, and that home had a view of a river. But even if I don't have a river view, I would still want to be able to look out the windows and enjoy. I don't want to be stuck in the back bedroom. I want to be a part of life as long as I can. I want to be able to watch and see what else everyone is doing, and to be able to be surrounded by my family. So number 3 is I want to be allowed to eat everything that I have denied myself so that I wouldn't gain weight in my younger years. If that means that I want all sugar items, that is fine. I don't want anyone to tell me about healthy eating and how bad it is for me to eat all of the things that I love, because that is what I am going to spend my last months doing, is eating everything that I truly love and enjoy. Number 4 is that I want treatments that focus on comfort care. So what does that mean? For me, I would love to have a urinary catheter so that I would be able to drink as many fluids as I want. And you might say, but you don't know what that means. And I would say, I do actually. Many years ago, I had surgery and had to have a catheter, and it was splendid. I could drink and drink even in the evening and at night and not worry about having to get up in the middle of the night to use the bathroom. So that is part of my definition of wonderfulness. Other people, like my husband, think that doesn't sound so very awesome for him, and I understand. But it is all about what is comfortable and wonderful for you, not what other people want. The other part is that I would want pain meds if I was having discomfort. Don't worry about me sleeping. I want to be comfortable. I want to not be screaming in agony or be uncomfortable. These are my last moments in life, and I want to be able to enjoy them with the people around me and feel comfortable. Number 5 is that I want everything to be thought of as a focus on quality time versus quantity. I don't want to worry about doing something so that I can live an extra day or a week or even a month. I want to have the focus be on quality. And that is what I do for all of the people that I give care to. I have 3 people at a time that live with me, and I always try to focus on what will bring them the greatest joy. And that is truly a gift that you can give to your loved one who maybe is on hospice, is to focus on the things that bring them joy. And even if it means that it will wear them out or make them tired, sometimes I have people that call when I have people that are towards the end of life, and they'll say, well, I don't want to visit if it's going to wear them out. And I always say, what are we saving their energy for? Go ahead, come. If your visit is going to be a blessing to them, go ahead and visit. Now, if you're going to come and bring angst and bring things that are undesirable, and you're going to come and just make it all awful, then don't visit. But I do think that sometimes we need people who are at this stage of life do need to have a little bit of things to settle. And if that means that there are relationships that need to be improved on, that forgiveness needs to be sought by either party, then this is a great opportunity to do that. And don't worry that it may shorten somebody's life because you've kept them awake or you've made them upset a little bit, but provide that forgiveness on both sides. It will make life for the one that's still alive better, and it will make it an easier passing for the person whose debts have been settled. So those are my 5 tips on thinking about what to do for your loved one that's on hospice. And I encourage you to think about what you would want and to talk to them about what they want. And don't wait until they're on hospice. Talk about it early. Talk about it with your children and your grandchildren. Talk about it as a part of normal life. You know, before we became so medical oriented, we used to have death that happened in front of our loved ones. And now it's all removed, and it becomes this thing that nobody talks about and nobody wants to think about. My children have grown up in a home where we've taken care of 3 people at a time, and people have died and in the home. And people always say, well, what about your kids? Isn't that upsetting to them? And isn't that just terrible that they have been around people who were dying? But quite to the contrary. My kids are now 20, and they now tell me that it has not been a bad thing. They are very realistic. It has not injured their psyche to discuss death and have it be a part of their life. And so I encourage you to give these things a thought, because it's so much easier to have a better preparation. When you wait until the last minute, then oftentimes you will be going and ending up with more care than you want. And that's where then people start thinking, well, I would want euthanasia because I don't want my life to be drawn out. Well, if you think ahead and make plans, then that doesn't happen and you don't have to have the euthanasia. So, if you'd like to have my free tips on how to be a great caregiver easily, put tips down below in the comments. And if you have ideas about things that you would like to learn more about, not just about death, but just about caregiving in general, please make a comment below. I would love to be able to make videos about the things that people need to hear. And sometimes things that I think are very obvious are not obvious when you haven't been doing care for 30 years, and I forget about that. So please let me know. I would love to help out however I can. And I hope that this helps for you. If it does, go ahead and subscribe and like my videos.